So I'm John Hockenberry. I'm your host. I'm also, you might say, both a beneficiary of the healthcare system and one of its victims. And as all of us interact with the healthcare system, we are filled with conflicting emotions often. In my case, there are plenty of people I want to thank and many individuals that I would love to wreak some form of revenge on. Hopefully those conflicting ideas won't in any way mar our conference, but this is a conference about ideas and notions and approaches in conflict. And that conflict is an opportunity for all of us to move forward and to think differently about the way that we do things. Our Korean guests and colleagues here have the opportunity, because of a generous impulse on the part of one of the members of the basic research community here at Mayo, to have real-time interpreting of this event and all of the events here at the conference, or particularly this event tonight. If you would like headsets for Korean interpretation, you can just go speak with Gail in the lovely blue dress there in the back of the hall, and she has sets of headphones for people who want Korean interpretation. Anyway, it's great to be back with you again here in Rochester on a spectacular weekend. The Vikings did something today. I don't know what it was. I heard some hysterical screaming. Did they actually hire a quarterback? No, they won in overtime. Sorry, excuse me. Hey, I'm happy the Giants aren't playing, right? So I don't have to be disappointed by what happened earlier this week. So this is going to be a great event tonight. Welcome to Transform 2012. We had great success last year creating and exploring a community of people who are trying to think differently about healthcare in its broadest aspects and in its micro aspects. We are here as members of a specialty. Let's think of what we're doing here at Transform as really a specialty. What do we call this specialty? I mean, we can say innovation. A lot of people use the word innovation. But it's a specialty of new thinking. It's a specialty called questioning the way we do things. We'd love to hear your ideas of what to call this specialty, because the notion of thinking differently about healthcare is a subspecialty. It is our aspiration that you think of this approach to healthcare, this collective community engagement, this collaborative exercise in thinking differently about healthcare is something you want to return to, in the same way as you might return to your professional organization, your subspecialty organization, your annual meeting where you make sure that you once again rejoin your community of like-minded practitioners who want to know what's going on the edge of the field. That's really what we aspire. In healthcare, whatever role we play, we need to be prepared to throw away the rules, to toss the prepared text out, to drop the conventional wisdom, to just raise the curtain if we can, to look at what's going on. And that's really the mission tonight. You're going to see a very different approach to thinking about public policy in healthcare, a very different approach to thinking about debate, to thinking about the inquiry of what's going on in the healthcare system. We are, of course, thrilled to have with us the Honorable former Majority and Minority Leader of the House of Representatives, Richard Gephardt, will be here a little bit later tonight. It is the case in Minnesota, of course, that you can always have a hot dish, you can always have a choir concert, and you can always have a theater. And tonight we have the Theater of Public Policy improv group here to work with Congressman Gephardt on some non-traditional, non-linear, I dare say innovative, and perhaps a little bit frightening, terrifying approaches to thinking about public policy in healthcare. And that's a little bit later this evening. But I want to kick things off by just exploring a little bit my own personal story in healthcare and and to try to frame the large idea that really what Transform is about. And all of you bring big ideas with you from wherever it is that you work in healthcare. And our mission here is to have the big ideas meet the small ideas, and the big questions meet the little questions, and the people who have best practices meet the individuals who will challenge some of those best practices. In healthcare, and whatever domain you're in, each patient is new, each event is new. You understand this every day. Each challenge is new. The vast body of knowledge, though, and the experience in healthcare that has been built up for a century in our era, that's the mountain. It's the scaffold. It's the ladder. It's the shoulders upon which we all stand to help the people who need our help. But at Transform, we're dedicated to the notion that we also need to know how to jump off the ladder, get off the scaffolding, leave the mountaintop, because we are not collectively or individually Moses or Yoda. It's another religion. You may have heard of it. We are Adam and Eve. We are seeing the world for the very first time, and in your experiences, in your own work, you know that this is true. We're also Alexander together. We're Isaac Newton. We're Lewis and Clark. We're exploring, inquiring, conquering, and yet, as T.S. Eliot said, and this is really a credo for me, this is the ultimate big idea for me here at Transform, we shall not cease from exploration, and at the end of all of our exploring will be to arrive where we started and to know the place for the first time. It is this cycle of exploring, of questioning, and not becoming complacent, and not allowing the things that have worked to work us, to limit and narrow our inquiry, our scope, our sense of questioning and doubt, our sense of challenge and opportunity, to see the place we have known all of our careers for the very first time. Can we do that once a year? Can we do that once a month? Can we do that once a week? Can we do that every single day? This is our mission. Consider the luxury of all the policymakers who get to talk about healthcare all the time, and there's some of them in this room, and we love them, and we love you. But in so many ways, healthcare is talked about from a grand blimp of business modeling, of marketing, of business plans, healthcare systems, companies, institutions, all of whom have the luxury to observe the healthcare system and the needs of our society from a huge blimp of abstraction. People who can basically take a statistical analysis, drive towards the normal, aim towards a bullseye that's hardly a bullseye of the 90th percentile, of the 50th percentile, of the 40th percentile, and achieve multi-billion-dollar success and leave the fringes for you to deal with every single day in your work. When a patient comes through the door and doesn't fit the model, when an individual comes through the door and doesn't meet the criteria of normal, the event, the outcome that just isn't in the books. We're all a part of a grand research project called, man, boy, that didn't work out according to plan. That's what we do in healthcare. And it is capturing those moments of, whoa, that's a big surprise, and making sure that that data is something we value, that each one of you who has experienced that surprise, that unexpected outcome, that unpredictability in healthcare, make sure that that information gets channeled up the system, not screened out by the modelers and the blimp riders to focus simply on what works 80% of the time, 60% of the time. This tortured word, efficacy, in healthcare. It was a happy word once. In our time, not so much. Healthcare policy professionals can write stuff like this. I love this. I don't even know what this is about. Support is the most frequently cited resource needed to adopt GLNs by the sunrise date. IT services, hardware, and software are limiting factors toward GLN adoption, especially for providers, 32%. The second most frequently cited need is education consultant support, 19%. It is interesting to note that intellectual know-how appears to be the greatest lacking resource. toward meeting sunrise date. I can sort of, as obviously you can, understand what's going on there. A lot of dumb people around here. We wish we could get rid of them. That's our limiting factor. Also, something about the computers don't work. IT, I guess, that's the deal. Somebody was paid to write that. In healthcare policy, the blimp riders drive what we do. We want to make sure at Transform that the information from down on the ground, the information from the individuoscopes that each one of you command, has value and gets pushed back up the chain. Let me give you a story about when I got into rehab. Paraplegic, T4, 5, some of you know what that means. If you don't, doesn't matter. But it was the jargon I learned when they hauled me in the ambulance to the hospital, and I ended up in rehab. And when you're in rehab, it's a little bit like a fraternity, sorority, fun house. In my case, it was a sort of a boys' locker room kind of mentality. And we spent a lot of time, playing games like who can produce the most urine for the nurses after we went out to drink beer at night, one night. I never won. Scarred for life, right? And we'd try to bust up the system, like if we could shut down the elevator that would lead everyone to physical therapy, we could maybe get a free day, up in our rooms being bored. Maybe we preferred physical therapy, but just shutting down the system was fun for us, seeing the expression on the nurses' faces. And of course, we're paraplegics. We don't understand that the PTs can walk up the stairs, okay, and do the therapy, right? Bunch of stupid crips, they don't know what they're talking about. So we never succeeded much, but we loved to mess around with the system. And our antics were adorable, were a part of our attempt to figure out who we were. Challenging the system, challenging what was expected is really a part of rehab. Sometimes funny, sometimes a little tragic, sometimes is a cry for help. It's an indication of some other things going on in the individuals in the institution. And the practitioners in a good rehab facility know when to back off and know when to pay attention. And my rehab facility was no different than a lot back in the 1970s. But it, like every institution, has a difficult time with individuals. And particularly at that time, with spinal cord injury, there weren't a lot of therapies. I remember my first question coming out of anesthesia was, think I'm going to be able to have kids? I'd already thought this through. I wasn't completely out in my car accident. And so I'd actually spent a lot of time in the ambulance going, all right, well, let's see, I can't use my foot, so that I can't use the other foot. I can still play the guitar, okay. Boy, you're not walking around. That's a pain in the ass. It's going to be rough. But there's wheelchairs. Okay, what don't I know here? I need some questions for that. Okay, can I have kids? Yeah, whoa, that's not working down there. Whoa. The doctor really didn't have an answer for me, and he would slide some studies under the door of my room, and I remember reading them, and it said in all of these studies, no. I said, Doc, why didn't you just tell me this? Well, we didn't want to shock you. So this is... When it came time for my employment assessment to be done, which is not something that's done anymore, or certainly not in the way that it was done for me back in the 1970s, I was taken to a very special place in the sort of voc rehab, occupational therapy part of my rehab facility, and half of this was run out of the state of Michigan. So it was shall we say, a less than completely satisfying collaboration between the state and a set of institutions that was determining the reimbursement rate for individuals who wanted either money for accommodations that would help them to be employed or specific tuition subsidies, et cetera, for continuing your education. And I had come from college. I was doing pretty well at the University of Chicago, where I happened to be at the time, studying mathematics. And because when they asked me, what are you studying? What do you want to do? What jobs are you interested in? You know, I put down mathematician. They went to their voc rehab categories, and all they had that related to math was an adding machine course and a bunch of books of long division and multiplying like 4 and 5 digit numbers. In addition to the tests that everyone had to do, which was to screw nuts onto bolts for an hour or so, to then count them, and they would monitor what you were doing there. And the antics that suddenly served me so well and served us so well, my compatriots and I in the little boys' locker room there at the rehab facility in Michigan, that were so adorable and indicated our individuality to the nurses and the PTs who were on the floor, who had individual relationships with us in this slightly more black box bureaucracy world of voc rehab and the state reimbursement criteria and the explicit models that had to be reached before I could be checked off as employable, good candidate, not a good candidate, whatever it was they did behind those clipboards. It was a different world, and there was no relationship. And so the antics that I brought to screwing the nuts onto the bolts, and at the end, the voc rehab person, the programmer, I think he was called, would ask me questions like, did you enjoy that? Yes. What did you enjoy about that? You know, I would say unhelpful things, but I thought they were just thrillingly clever. Things like, I really like to screw. So it's always been something I've been very, very interested in. So could we please do more of that? And he noted this. Perhaps a bit longer than I suspected he would note this. And he didn't laugh, of course. And then when we did the arithmetic, I was very frustrated, and I would say, this isn't math, this is arithmetic. Not math, arithmetic. I would get a little upset. Like, why do I have to do long division? You can do this with the machine. We have a machine. They brought the machine out. And then I would sit for an hour and work on the machine. And then he would ask me, so, what do you think of math? Well, I still love math. Nothing that I've done here is math. And of course, I began to sound like an arrogant, annoyed, impatient, not a team player kind of individual to this voc rehab person who was evaluating me for employment. The final thing before we were done with this evaluation was you were supposed to look at these pictures and make up a story about what was happening. And, you know, it's sort of obvious. Somebody was on their way to a parking lot. What does it look like they're going to do? Oh, get in their car and drive. You know, someone is like walking towards a church. What do you think they're going to be doing? That kind of thing. And my friends and I, or my one friend and I in rehab, made up elaborate stories about how she had already stolen one car and armed with her jimmying tool, she was on her way to the other car because she preferred Buicks to Oldsmobiles. You know, in Michigan, this was something that you really paid attention to back in the 1970s. To make a long story short, by the end of all this, I thought, well, boy, that's over. Thank goodness. Can I go back to college? At which point, voc rehab weighed in here and said, well, we don't know if you're actually eligible for any tuition subsidies, and we don't know if we would recommend to your financial aid. I already had financial aid, but the financial aid people back in the 70s, because I was suddenly a disabled person, really wanted to know if they should continue the financial aid, because suddenly I was an individual who was maybe a less than likely candidate or a differently likely candidate to complete college and to have a successful outcome in higher education. And I was given a chance to look at my file, and when I looked at this, you know, Mr. Chucklehead, with all of his clever jokes about screwing and things, it said in the file that I was clearly not a candidate for employment, that there were very serious problems with me dealing with my disability, and that voc rehab would not recommend any program of subsidy or assistance for this individual for the foreseeable future. And I looked at this and I went, well, you can't possibly be serious. How does suddenly being a paraplegic bear on my ability to do math in college? I want to go back to the world that I came from. And once again, the programmer noted, on the report. And I left the hospital and realized that this report was sort of out there. And I thought to myself, what's going to happen to me? What is going to happen to me? Well, nothing happened. I went back to college, and I went to school and was successful. I actually changed schools, not because there was anything problem with my school. It was just the winter of 1976 was a little tough on someone in a wheelchair, particularly someone in the first year of being in a wheelchair. I eventually went back to Chicago and lived there, was very, very successful, and had a decent career in radio that's still going on, despite my arrogance and impatience and inability to be a team player. All of which I've discovered to be, maybe there was a grain of truth in some of all of that went on there. But again, it took a long time to have that kind of wisdom. Even I can be a Yoda. Years later, though, I ran into the person who was at the center of this whole thing, my kind of team counselor person at the rehab facility, a guy named Ron, who I'd sort of forgotten about. I'd passed through his world in a rush of, I'm a 19-year-old who's got to get back, to doing what 19-year-olds do. I was in college, and this wheelchair is kind of a detail. Get me back out on the streets to have fun and to do what it was I wanted to do. And as you know, and I now have 2 teenagers, you can't tell teenagers anything, and certainly not me. So I didn't have a clear picture in my mind of Ron, but years later, doing events related to disability where I was talking about a book that I'd written about my experiences in the Middle East, some of my experiences as a journalist in Washington and around the United States and around the world. I went to a lot of communities, and I went back to Michigan, not Grand Rapids, where I had done my rehab, but a community nearby, and in a line of people with books asking to sign, there was an individual who, man, that guy looks familiar. And he came towards me and he said, do you remember me, John? And I said, I got an inkling, but I don't really know. Yeah, I'm Ron, your rehab counselor from Mary Free Bed Rehabilitation Hospital in Grand Rapids, Michigan. I said, oh yeah, right. You were on that team that sort of decided whether I was a useless nobody or could. Yeah. I was the head of that team. Oh, God, I remember you put all those reports together about my medical condition, how good I was doing in PT, all that stuff with Voc Rehab. Oh, yeah, I did all that. And I was signing his book. I thought to myself, he wasn't the evaluator guy. This was a guy who was just sort of my team advocate. He knows about that report. I said to him, Ron, I remember all these weird tests I had to do, and he started nodding. And the math they made me do, and all the adding and subtracting and division and all this stuff. And I remember at the end of that report just really said some just bad stuff about me. And I always wondered, what happened to that report, because I left feeling like I'd completely screwed myself. and Ron says, oh yeah, I remember that report. Yes, I remember it well. Well, who looked at that report? And who made a decision on that report? Because I left rehab and nothing happened, but I was always sort of expecting some shoe to drop at some point. Every job interview I went to, I was sort of expecting, so are you a team player? Or, little impatient, are we? People at National Public Radio, when I used to work there, saying, we're here in public radio. We really like team players. Are you one? These are my fears at every job interview since then. And Ron looks at me and he goes, I've followed your career, John. And first of all, we're very proud of your success. We in the rehab community, and even the people on that team, we knew you. We had fun when you were doing all of your antics and everything, and we paid attention. We had no idea what you would be, but we thought something was happening here that we wanted to pay attention to. And I said, well, but Ron, what happened to the report? Well, John, as a journalist, you've covered this, right? Often government documents just get lost somehow. They end up in the garbage or the shredder. You've covered stories like that, haven't you? And I said, yeah. So, and then I saw him wink at me. And I saw him, sort of say, don't worry. We had a relationship. And something like that trumps something like that. And so that was Ron's intervention in my life. Who knows what that silly report would have done? Who knows what impact it would have had? Probably none. But the idea that there was somebody there standing guard, vigilant for the unexpected outcome, expecting the nonlinear result, anticipating the what could happen here, not what is happening here. Someone who was vigilant for that and wasn't going to allow some preconceived box to sort of snuff out the light in a life that was just getting started. And it's Ron's impulse that every single one of you have either had or perhaps wished you had at certain points. And it's that we celebrate here at Transform. The idea that the pre-existing model doesn't always work. The surprise that we're experiencing right now is an opportunity. We must remind the policymakers that the system must plan for new thinking, must anticipate the unexpected outcome, must allow for throwing out the rules. This is how problems are confronted. This conference aspires to be a subspecialty for asking the tough questions. We seek the cutting edge of new thinking. This conference aspires to be the place where best practices are forced to justify themselves as well as celebrated, and ideas outside the traditional hierarchy do not need a special credential to be considered. That's how things transform. Did you hear anything of value, any of you at either of the conventions, specifically on the needs of our society regarding healthcare? Great speeches, great rhetoric, well-orchestrated events in Tampa and Charlotte. Did anyone hear anything of value, anything on the edge, anything that challenged you to think differently about the urgent healthcare needs of this society? Well, what they won't say, we will here at Transform. What they won't ask, we hope you will ask here at Transform. And ask yourselves. There will be opportunities throughout the next couple of days for you to both ask yourself the question, what do we do today? What do we do today to ensure that the unexpected outcome is preserved and pushed forward in the system to be valued and evaluated by other practitioners? What do we do in a year? What problem do we address? What priority do we need to address? And what do we do in 5 years? There will be many, many opportunities for you to ask and answer those questions, and we will share them over the next 2 days. There will be many, many opportunities for you to do that. What they don't ask, it's our responsibility to ask. Sometimes those government documents get lost. Sometimes there is somebody on the point, ready to be vigilant for the unexpected outcome, the unpredictability that is the design thinking. Don't fear it, embrace it. That is the engine for Transform. Thank you very much.